Good afternoon, ladies and gentlemen. I know we are from very extensive afternoon sessions. We have been sitting quite a lot. Could I ask you, in the spirit of kickstarting networking and knowing one another, could you greet the person next to you as a sign that you have been interacting? Great, great. Great. Yeah. Thank you. Thank you. Thank you very much. This is what we will need when we leave daily: networking, collaboration. And so it is important that you begin to know one another and start networking right in here. This afternoon, as you are all aware, we have got distinguished chairpersons that chaired sets of parallel session this morning and this afternoon. On my right, we have Bibi, popularly known as Bibi, but her name is Boitsebo Gaius, Senior Food and Nutrition Security Advisor in the new Partnership for Africa Development, NEPAD Secretariat based in South Africa. So we'll be reporting back on sessions that discuss enhancing nutrition along the value chain. Then we have next is Mr. Maximum Torero, Director, Markets, Trade, and Institution Division, and Director, Latin America in the International Food Policy Research Institute. He will be reporting back on the issue of cutting health risks along the value chain. Then we have Soit, that is not here at the moment. I hope he will be joining us. I don't want to introduce him in absentia. Let him be here first, then I will introduce him. So these are the people who chair the first set of parallel session this morning. And in the session this morning, the three sessions explore the potential opportunities and constraints for improving nutrition and reducing health risk along all the value chain. And in doing that, they had an in-depth look at the agricultural value chain from supply to demand issues, production and processing, to food use and demand by consumers. Now, the session this afternoon covered learning from country case studies, which was chaired by David Beckman, that I'm sure is known to many of you. Is a World Food Prize laureate, and he has done a lot of work along that line. He will be reporting back on learning from country case studies. Then next is Amy Simons, former Assistant Administrator, United States Agency for International Development, USA. She will be reporting back on the parallel session that look at learning from program interventions. Then we have Mr. Anderson, Director General for Research, Policy and Global Issues, Department for International Development, DFID, UK. He will be reporting back on the parallel session that look at learning from evaluations. As you are aware, all these are interrelated. So I would ask you to pay close attention to the reports that they will be presenting. The ground rule is that each one of them will not exceed 5 minutes. And I ask them to stick to that. May I therefore, without further ado, ask Bibi to present the report.
I believe the mics are on. Okay, good afternoon, ladies and gentlemen. You see, that's why I just go by Bibi. It's short, it's simple, it's sweet. I have the privilege this afternoon to be reporting back to you on the session that was looking at enhancing the value chains for nutrition. We had a really excellent set of panelists from a variety of disciplines who gave us a rich platform for discussing the subject at hand. Now, what are nutrition value chains? They are nothing but a framework in which we can add value for nutrition for the consumer of that product. In looking at nutrition value chains, obviously you have to have the activities on the one hand and the actors on the other, all with the intention of ultimately improving food consumption and improving the dietary quality for better nutrition. Now, in the discussions, some key points came out very strongly. One is that we need to look at the value chains because they have to improve supply. We need to improve the supply, so we look at the value chain. And secondly, we need to look at the demand for the commodity and for the outcome, for the value add. Thirdly, to provide a framework for coordinated multi-sectoral solutions. And it is not easy working in the world of nutrition because nutrition doesn't come as a sector itself. Nutrition works through a multitude of sectors. So in looking at the value chain, one needs to think about what agriculture is adding, what industry is adding, what are the benefits for education, what are the benefits for health, and ultimately for development of the individual and the overall national economy. And one of the things is that the value chains are about providing a framework to create economic value and add nutritional value while addressing the trade-offs. There are a lot of trade-offs to be had. You can have a value chain that truly improves nutrition. On the other hand, as we saw in the presentations this morning, because of modernity, because of development, some value chains are actually de-value chains. Furthermore, when you look at value chains for nutrition, you have to ask yourself, and first and foremost, define the nutrition problem that you are wanting to address. There's no point in working through the whole system and at the end you have not addressed that which you wanted to address. And secondly, the value chains require a range of players. Like I said, nutrition is not one sector, it takes a whole gamut of people. But more importantly, value chains present an opportunity to leverage the private sector, raise resources, build capacity across the entire chain. And women are central in this whole process because women are usually the carers in the home. They look after children, they provide the food. But what is interesting is that when we look at what women have to provide, when the business is small, it is small, medium enterprise. When it gets big, the men jump in. But what we're saying is that women should be at the heart, at the center, at the core, driving and being the beneficiaries of the value chains. Multi-sectoral approach, learning. We need to learn. In terms of this, research is going to be critical. Multi-sectoral research and building the necessary capacity across the whole process. Nutrition outcomes are not easily addressed by just one sector. We need to look at who plays that role. In terms of examples, you have the documents in your packs, wonderful documents. I urge you to look at them because they provide some really succinct examples of how the value chain approach can be used to improve nutrition. Now, ladies and gentlemen, we can choose whether we want to put money into a black hole that does not have clearly defined objectives for the right value chain approach, or we can choose to put money in a process and a product that helps us to grow and that brings about better income and therefore better livelihoods and better development. So we shouldn't allow the chains to be binding and gagging. We should allow them rather to help us improve better along themselves, along the chain. Thank you.
Thank you, Bibi, for that precise. I'm sure you are taking note of that, because this is a primer for tomorrow's parallel session. May I, without further delay, now call upon the next presenter, Maximo Torero,
yes,
please.
Yes, thank you so much. So we just finished the session a few minutes ago, so let me summarize. The session was on cutting health risks along the value chain. So there are 6 key points that I want to bring up as a result of this discussion. The first one is that clearly there is a need of a chain approach, and we need to look to all the different points of the value chain. Why? Because it could be that we can resolve the problem, the health problem or the safety problem, in the soils, but later on the problem could appear in the storage. So if we press a button and resolve one problem, it could be that another button will come up and another problem at a different point in the value chain. That's why the whole chain approach is central to look into health risks and how we produce and how we move from production to consumers. The second point is that food safety shouldn't be only an issue for exports. We clearly know that there is a missing market for information. There is a market failure. The information on the attributes of the products and the standards and the risks that you affront when you eat those products are not clear. And there is more investment needed to be able to provide that information. But certification for exports is not the only solution. We also need to care about local markets and local consumers. So food safety shouldn't just be an issue for export markets, it should also be an issue for local markets. And for sure, food safety will bring new attributes, and those new attributes to the product also are linked to incentives and to price incentives. But we shouldn't assume that local consumers won't be willing to pay when they know what are the risks they are facing when they eat the food they are eating. So that's very important to understand and to know, and there was a very nice example of cellular phones. Nobody will have expected that people will buy prepaid phones, which are the most expensive compared to postpaid phones, and the poorest are the ones using them. So we need to be very careful that information is important, and the knowledge of the attributes of the product could also create a bigger willingness to pay for local consumers. But we need to find a minimum safety requirement and also not over-exercise the certification requirements. The third point is it's important to identify the risks, it's important to do a risk assessment analysis, and also it's important to identify the cost and the mechanisms through which we can resolve the risks. One solution won't fit all. Farmers are at different sizes and at different levels, and the risk could be different across them and across the chain. So it's very important to have a clear risk assessment and a clear cost-effectiveness analysis of the different possible solutions available to resolve those problems. We shouldn't expect small farmers to have the same solutions than medium and large farmers. The point number 4 was that there is a triangulation between production, communities, and health. And this triangulation is complex, it's not easy, as everything we have been discussing in the last days. Also, it's unpredictable. The idea that I solve the problem in the soil, but the problem then could appear in the storage. And for sure, to be able to analyze this triangulation, we need to bring interdisciplinarity. It's not only an issue of economists, of nutritionists, it's also an issue of science, of scientists, both in the academia, in the NGOs, in the private sector, in the public sector. So this triangulation brings all the different sectors together, and we need to bring this multidisciplinarity if we want to find the link between health risks along the value chain. The fifth point is the smallholder paradox. We knew that the smallholders are more productive, and that was the benefit of the Green Revolution. But today, with the modern value chain, the issues are not scale neutral like they were with the Green Revolution. So to be able to link to the value chain, farmers have to assume a minimum fixed cost. Those are the cost of certifications, those are the cost of storage and standards. And those fixed costs cannot be afforded by the farmers, small farmers by themselves. And that's where collective action, farmer associations, and vertical coordination mechanisms like contract farming could play a crucial role. There was a nice example of Maha grapes and how they coordinate across farmers to be able to resolve that problem. So this lack of scale neutrality today to link to the new and the modern value chain is very important, and we need to focus on that because it's not only an issue of productivity, it's also an issue to cover those minimum costs to be able to participate in the modern value chain. And the last point is that clearly we need more knowledge on the links between the health risks and the human health. There is a lot of talk about the effects that a specific risk on a plant or on a product could have over humans, but there is very little solid evidence that could argue causality. So there is a significant need for doing investments in being able to create those links so that we can really identify causality and be able to resolve them if necessary. Thank you so much.